I'm Dr. William Adams with the Orthopedic Institute of Western Kentucky, board certified foot and ankle surgeon by the American Board of Foot and Ankle Surgery and Foot Surgery, as well as rear foot reconstruction and ankle surgery. I'd like to talk to you today about total ankle arthroplasty with implant or ankle replacement, really becoming the gold standard for treatment of ankle arthritis. Ankle arthritis includes not only primary osteoarthritis, but rheumatoid arthritis, as well as post-traumatic arthritis, which is a common type of arthritis after an injury to the ankle, such as a fracture. This type of surgery is actually performed on an outpatient basis under a general anesthetic. Typically, I'll have anesthesia do a regional block, which means they make your whole leg numb. So when you wake up, you really don't have any pain. That can actually last up to 3 days. I use a couple different kinds of implants. Both are from Stryker, which used to be Right Medical. The approach to the ankle is an anterior incisional approach. This procedure begins with preoperative CT navigation. We send the patient for a preoperative CT scan that is performed from above the knee down to the foot and ankle. Once that's performed, I review it. We send it off to the engineers at the company who review it and look at it. They prepare a report for me, which I review. And once I review it, then it's approved. Then the engineers build these custom 3D printed alignment guides, as well as a custom 3D printed distal tibia and talus that matches it's patient specific. So incision is from an anterior approach. Once we get down to the bone, this tibial alignment guide is placed on the tibia. Again, you can see how that fits. It's just like a puzzle piece. We place it on the patient's tibia, and then pins are placed in this area here. All the cuts and alignments are based on that pin placement. There are several radiographic checks during the procedure, so it's a very reliable, very reproducible technique. Same thing with the talar component. There's a 3D printed talus, which is the bottom side of the ankle joint, and then an alignment guide that's specifically made for that. So that type of procedure, again, outpatient, general anesthesia. Typically, I keep patients off of their extremity for about 4 weeks, followed by 2 weeks partial weight bearing. Partial weight bearing means that you're beginning to put some weight on your foot and ankle in a boot, maybe with a walker or crutches. And then weeks 6 through 8 are just weight bearing in a boot. You will need some physical therapy afterward. Typically, that's about 4 to 6 weeks of physical therapy. Goals with the surgery are range of motion that continues throughout the ankle, as well as a significant decrease in pain. Again, if you talk to somebody about ankle arthritis, or you have ankle arthritis, even if you've been told you're not a candidate for ankle replacement, please come see me and we'll talk about it.